Coffee, tea, chocolate. What do all these things have in common and what do they have to do with sport performance? There's controversy surrounding caffeine's effect on exercise. However, there still needs to be further research done on how it pertains to performance. The reasons for the controversy on how caffeine affects the body are how it affects it physiologically, how it affects substrate usage, and whether or not the evidence clearly states that caffeine should be a banned substance. So before we get into the nitty-gritty of how caffeine affects the body, we need to have a basic understanding of adenosine and what role it plays in the CNS. So adenosine is a nucleoside found in DNA and RNA. It can be found in the liver, in the adipose tissue and muscle, and it can also be found in vascular endometrium. Our main focus is going to be on the muscle because in the 24 receptor sites, A1, which is our main focus today, is going to be mainly in the muscle. So caffeine is a non-specific competitive adenosine receptor antagonist, which means that it has an opposite effect of what adenosine does. So adenosine has an effect on sleep. It decreases the heart rate and decreases the sympathetic nervous system. Caffeine has the opposing effect. It will increase the sympathetic nervous system. It will increase heart rate and overall wakefulness, which we all need in the morning. So it's the reason we have coffee. Sergio Furey stated that caffeine has the same stimulating effects as amphetamines and cocaine on a much smaller scale, of course. So there is some study out there that says that caffeine is addictive, but is usually not abused, such as caffeine and amphetamines. If this is the case, it can be said that there is an increase in subsequent exercise performance when caffeine is consumed. However, research has indicated that the mechanism of caffeine needs to be further studied. Another mechanism that caffeine can affect is substrate use, or that has been studied to affect is substrate use. It's been found that caffeine really only affects the body better in 3 to 6 milligrams per kilogram of body weight. Anything more, it really doesn't affect. So in small doses and at high intensity, long duration interval exercise, it affects that kind of exercise better or more. Graham and colleagues tested the effects of caffeine on carbohydrate metabolism and found that there really was no effect on either of those, that there was no glycogen sparing effect and the fat metabolism was not increased. Out of all of the substrates that they used in the study that they performed, glycogen, citrate, acetyl-CoA, and triglyceride levels were not affected during exercise. However, cyclic adenosine monophosphate was affected. This finding supports the theory that caffeine's main mechanism is an adenosine receptor antagonist. They also did a combined study with other authors and previous research that they had done on RER, VO2, and intramuscular triglyceride levels. And this did not support the fact that caffeine affected fat metabolism, and additional studies done using stable isotopes also found that there was no change in carbohydrate levels or fat metabolism. So although these studies have not concluded whether caffeine can inhibit enzyme activity, there is enough evidence to suggest that further research is necessary. So the main point from both of those two is, does caffeine work too well? And if it does, should it be banned? Because caffeine is found in everyday foods and it's so often used by athletes, people who go to work every morning, people who drink coffee, who love the taste of caffeine, the question is, are some athletes using it as a way to improve their performance? So based on the research provided, it can be said that caffeine does in fact have an effect on sport performance. But is it being abused? This supplement was taken off the anti-doping list in 2004 for the lack of evidence shown that although Juan Caso found that in urine samples there were only 16 out of 8,361 participants, 16 of those people did not, they were over the cutoff, which is 12 to 15 picomilliliters in their urine. But he could not prove that the athletes that were above this cutoff point were using it as a performance enhancer. So, while some studies concluded that glycogen sparing increased fat metabolism was a mechanism of performance enhancing effects of caffeine, there were too many discrepancies in the research. So, it supported the theory that caffeine affects adenosine receptor sites more than it affected fat metabolism or glycogen sparing. So keep enjoying that morning cup of joe or that shareable size candy bar.